Good afternoon. This is Dr. Barry Gritz, Houston's dancing psychiatrist. Yes, I am going to be dancing later today. Going to be teaching out at a facility at a wonderful gym that I teach at Tuesday nights off of Katy Freeway by Fry Road. If y'all are available to come out and dance, love to dance with y'all today. That's going to be 5:45 today. But our topic today, as Houston's dancing psychiatrist, we're going to be talking about having the improvement in your mood to go dance. And we're going to be talking about the dorsal lateral prefrontal cortex. And we're going to be talking about a new exciting treatment that just became available that is going to be a treatment option for psychiatrists and for patients as far as treatments of depression that's involving treatment of the dorsal lateral prefrontal cortex. Let's talk a little bit about the biology first, and then we'll go into the recent study that was done, and we'll also look at the possible treatment option as one of many treatment options. One thing you'll hear me say a lot is I want you all to consider this as a tool in our tool belt. I consider this as a new tool in my tool belt for the treatment of depression. It's not going to be the only weapon. It's going to be one tool of many in the tool belt for the treatment of depression. But let's talk about a little bit about the biology of it. Also, want to remind y'all, anything we talk about, go back and speak with your clinician, whether it's your psychiatrist, whether it's your nurse practitioner, whether it's your primary care doctor, whether it's your OB-GYN, whoever's providing mental health treatment for you. Please go back and use the information that I provide you with, do your own due diligence, and then speak with your clinician. My whole goal is to provide options, to provide knowledge, and to just be a part of y'all's day as being helpful in y'all's everyday life, because this is about health and wellness. So we're going to be talking about always psychiatric issues and other issues that can affect your mental health and your physical wellness. That's the whole concept of the Houston's dancing psychiatrist, Dr. Barry Gritz. Here, let's go back to the dorsal lateral prefrontal cortex, the DLPFC, dorsal lateral prefrontal cortex, sometimes referred to as the CEO of the brain, because it's involved in a lot of very complex functions that are important in our functioning that we consider more of our human characteristics. It's one of the last areas, the prefrontal cortex in general is one of the last areas to mature, which is something you hear about with adolescents and adults. It frequently doesn't fully mature, that being the prefrontal cortex, fully until the mid-20s. If you want to think about where the dorsal lateral prefrontal cortex is, I want you all to think of the upper outer corner of your forehead. The upper outer corner of your forehead. The prefrontal cortex is involved in executive functioning. That's decision making, planning, weighing risks and benefits. It's also involved in mood regulation, i.e. mood regulation. It's also involved in working memory. As you're doing an activity, okay, I'm trying to do this activity, I'm trying to stay on task and remember what I'm doing as far as this activity. Now, the whole concept of the dorsal lateral prefrontal cortex and the treatment we're going to be talking about is that the dorsal lateral prefrontal cortex is felt to be hypoactive in depression, i.e. the whole concept is that in depression, one of the many things that goes on, and you notice I said many things that go on, is what we call hypofrontality. Hypofrontality refers to low levels of chemical activity going on in the brain, including the prefrontal cortex and the dorsal lateral prefrontal cortex, which results in patients having cognitive slowing, amotivation. And that's why treatments of the dorsal lateral prefrontal cortex, whether we do it pharmacologically with medications, whether we do it with RTMS, whether we do it with ECT, whether we do it with psychotherapy, because I think all those modalities do affect the prefrontal cortex and the DLPFC, the dorsal lateral prefrontal cortex. But the whole concept is increasing activity in the frontal area and including the DLPFC, the dorsal lateral prefrontal cortex, to help with those symptoms of cognitive slowing and motivation. And you notice I say that because if you had to say what symptoms I see most commonly in patients with depression, is that amotivation, that lack of drive, initiative, joy, pleasure, desire. And I want you all to remember that depression, as well as being an emotional condition, is a cognitive condition. It affects your thinking. It affects your ability to think, which affects your work abilities, your ability to function in your household, etc. So it's really, really, really important. That being said, we're going to be talking about something that I just read about that I'm excited to have as one of the tools in my tool belt, not the only tool, and that is a technique. And it's actually a wearable headset called the Flow 100. The Flow 100, made by a company called Flow Neurosciences. It's meant to deliver what we call TDCS, the letter T, DCS, which is transcranial direct current stimulation to the DLPFC, to the dorsal lateral prefrontal cortex. This became FDA approved in December of 2025, so relatively new. Try to bring y'all new stuff to the forefront at the Dancing Psychiatrist, that being Houston's Dancing Psychiatrist. And the approval that was made for this was based upon prior studies that showed efficacy and or safety with prior studies with TDCS, transcranial direct current stimulation. But there was a study in JAMA in 2024 that did look at 174 patients. Some patients were treated with the Flow 100 headset, and some were treated with placebo. And looking at the response and remission rate, we're going to be talking about a lot on this show what response and remission means. But response refers to greater than 50% improvement in depression rating scores. Usually in psychiatry, in clinical trials, they use a rating scale called the MADRS, which stands for Montgomery-Åsberg Depression Rating Scale. In clinical practice, we often don't use the MADRS unless we're a clinical setting. We often use something like a PHQ. We use a QIDS. These are easy surveys and easy subscales that we can use in everyday practice, but the MADRS is used frequently in clinical trials. So what they found is, in this trial of 174 people, and it was looking at the change from baseline to outcome at 6 weeks, which is generally what we see. Antidepressants usually look at changes in 4, 6, or 8 weeks. For unipolar disorder, for bipolar disorder, often they look at 3 or 4 weeks. But that being said, at what was the response rate of the active drug, meaning the headset, versus placebo, which was a sham, SHAM treatment? And it was 44.8% for the active treatment and 21.8% for the placebo. For remission, and remission is different from response. Response means you've had a 50% reduction in your previous depression rating scales. You could have a response and still be quite clinically ill. You're going to hear me say that a lot. You could have a clinical response and still be quite clinically ill or moderately ill. Remission is where we're shooting for. Remission is when you are well, and where your reduction in your depression scores are so significant that you're considered well. In this trial, 34.5% had remission, while 21.8% of the sham or placebo treatment had remission. Once again, significant improvement was seen. So what do I take home from this data? What I take home from this data is, based upon that it is FDA approved, because I do like things that are FDA approved, even though you'll hear me talk sometimes about stuff that's non-FDA approved. If I ever talk about stuff that's not FDA approved with y'all, I will say to do the same thing I do in this office when I have a patient here. And that is, if a drug is not FDA approved for a purpose, I will tell you it's not FDA approved. We will talk about data to support that it might be useful, but we will definitely talk about it, and it will be documented, and we will have that conversation. We're going to do that same thing here. When things are not FDA approved, we'll talk about that. But this being said, it was FDA approved for what patient population? Good question. I'm glad y'all asked. It is FDA approved for patients who have moderate to severe depression, adult patients, moderate to severe depression, and it can be used in conjunction with other therapies. So I think that's useful, because likely when I'm first using this, I'll probably be using it with other therapies, although I might have a patient who doesn't want medication, who wants to go this route first. While this is an at-home treatment, it is, and this is not the headset. while it is an at-home treatment, it is still requiring a prescription. So it's not something you could currently that it's planned to be purchased without a clinician's prescription. So it is going to require a prescription that, as far as I know about. People are going to ask me, well, what is the estimated cost? I would direct you back to the company that makes it. I've tried to get data, meaning I'm hearing rumors about $500 to $800, but that is just what I get off LLMs, large learning models like Gemini, like ChatGPT. So I cannot tell you for sure what the actual cost is going to be. That's what I've seen based upon those sites, and those sites have been pretty accurate. I mean, there are other LLMs that I use as a clinician, but I have to tell you, I've been pretty impressed with those two LLMs that I've just mentioned. Speaking of LLMs, large learning models, I want to instruct y'all, encourage y'all, if you ever use an LLM, take the information in, but then go speak with your clinician about it. Don't assume that everything you see on any LLM is absolutely correct. Take that data and then go speak with your clinician. That being said, where do I see this being useful? Well, it's going to be useful, I think, in patients that I formally and still will refer for RTMS. With RTMS is a type of therapy that is going to hit a more localized area of the brain, while the whole idea of direct current stimulation is a more global effect, although the Flow 100 is meant to be more addressing the dorsolateral prefrontal cortex. So the ability of what I like potentially about DTCS is that DCS can actually get more deeper into the brain. But am I still going to be referring people for RTMS with refractory depression or moderate to severe depression? Absolutely. I think we're going to need multiple tools on our tool belt. I still don't think that I'm going to still have some patients who ECT is going to be medically necessary. So once again, it's nice to have more tools in your tool belt. So the summary, the take-home message from this is an exciting new modality that is going to be available for us as clinicians and y'all as patients, but we're all patients, for the treatment of moderate to severe depression as another tool in our tool belt to help those dorsolateral prefrontal cortical symptoms, which are, once again, often cognitive fog, lack of drive, motivation. Hopefully this is helpful. If there's anything else y'all want to know about, certainly I always encourage questions. If there's topics you want me to talk about, the more that you let me know, the more I'm likely to address that issue. So please feel free to send me an email at houstonsdancingpsychiatrist@gmail.com. houstonsdancingpsychiatrist@gmail.com. And please subscribe to my YouTube channel, which is @BarryGritz, Houston's Dancing Psychiatrist, @BarryGritz. The more subscriptions I get, the more encouraged I am to keep doing more of this. I'm like a plant, I say. I photosynthesize. When you subscribe, that's like giving me sunlight, giving me nutrients. It's going to help my roots grow, and then hopefully I can spread that sunshine and I can give that oxygen to y'all, because that's what plants do. They give us oxygen, right? That being said, I am going to sign off, and I am going to encourage you, please subscribe to my channel at Barry Gritz, Houston's Dancing Psychiatrist, and y'all have an amazing rest of your day.